Hey guys, welcome back to Dental Dork. Today I have the opportunity to talk with a man named Sean. Sean is 36 years old and has suffered from head, jaw, neck pain, even excruciating migraines that have landed him in the ER. Through his research, he was able to discover that they were all interconnected. He is now 2 years into his journey with success of drastically minimizing his pain. In this video, we discuss his discovery process, his failed night splint, the success of his second splint, his ENT surgery, his gum graft, his current braces treatment, and he even discloses his doctor's name and the cost factor or the finances or expense that it has been for him along his journey. I hope hearing his experience can be helpful for others and bring hope to the ones that really need to hear it. Enjoy! Okay, I'm going to just open up my notes here, and I'll probably take some notes as you're telling your story, just because it's a habit of mine that I like.
Always.
It's nice to meet you.
You too.
Thanks so much for, being willing to come on here and share your story with us.
Yeah, for sure. You really helped me so much as far as opening my awareness to what was going on. So happy to help other people with that too.
Well, thanks. Well, you want to jump right in and start with telling us where it began?
Yeah, definitely. I think I've had a revolving set of symptoms kind of my whole life as far as migraines, inability to sleep, jaw pain and facial tension, kind of that shoulder pain and all of that. And for quite a few years, I just thought these were all independent issues of each other. And kind of because of that was discouraged from really finding much of a solution for any of it.
On a scale of 1 to 10, how bad was your pain level, or what was the highest that it did reach?
I'd say 10 for sure. I got to the point where I was kind of, going days, not really eating much at all, and really wouldn't even finish my work days, feeling fully just because the pain in my kind of just the muscles that were getting the tension from where my jaw position is at was really causing a substantial amount of issues. So I've had migraines my whole life, kind of off and on with the jaw pain. And then as of about 2 years ago, it started to get to the point where it was just debilitating.
Oh, man. 2 years ago, you said that was?
Yeah.
And you had never connected the dots that they all might be correlated?
So at that point, I still hadn't. And I was at my regular dentist for a checkup, and they noticed that it looked like I had been clenching quite a bit. Mm-hmm. So they started asking some general questions and decided to get me a splint for my lower teeth, and with the intention of kind of pushing my jaw up and back.
Oh, really?
And the dentist at the time said, if you think you have any breathing issues, now is the time to address it. And in the back of my mind, I knew I had some breathing issues, but was so stubborn about it that I just was kind of like, it's fine. Let's go forward with this.
What did that mean to you when he said breathing issues? How did you know you had breathing issues?
For a long time, I've kind of felt like I had the inability to fully fill my lungs when I took a breath. And I run quite a bit, and sorry, my dog's on the bed. I run quite a bit, and when through some different running training programs that I've been through, would kind of say, the warm up needs to be something that you can continue breathing through your nose for. And I'm thinking, I can't breathe through my nose sitting down. So I had a lot of different kind of indicators. And then when the dentist said that, it was like, all right.
Confirmation.
Yep. Yeah.
Okay. So did you move forward with the splint, or did you say something about airway and then go down that rabbit hole, or what was your next step?
A little bit of both. I did the splint with my dentist for probably about a year, and it didn't seem like it was doing anything. And I kind of reluctantly then gave in and thought, okay, I'm going to go to a ear, nose, and throat doctor. And within a millisecond of the doctor looking up my nostrils, they could tell that it was pretty badly deviated. Okay. So I basically spent an entire life not really properly breathing through my nose. And what that kind of caused, I think, over the long run is from just so much mouth breathing. My jaw was jutting forward and had grown to the point where it wasn't sitting properly in the joint.
Did you, if you had said, like, before you really saw your dentist and anybody mentioned anything about breathing, did you feel like you would have called yourself a mouth breather? Would you have identified yourself as a mouth breather?
Absolutely not. No, for sure not.
You came to that conclusion after education, just looking that up and kind of increasing your awareness.
Yeah, well, I think you have one specific video where you're kind of starting to talk about your awareness with that, and it was like, wait a minute, that's exactly what's happening to me. And kind of relating the fact that my migraines, my sleeping issues, jaw pain, facial muscle pain was all related. It's like, okay, this is huge. So I think at that point, that was kind of when I decided that it was best to move forward with whatever I needed to do to fix the problem, essentially.
Wow. So yeah, we used to, well, I still refer to them as sneaky mouth breathers, people that are mouth breathing, but it's not like that classic Napoleon Dynamite face where he's like with his mouth open, you know.
Absolutely.
It's sneaky and people have no clue that they're even doing it. It's wild how the body just adapts.
Yeah. I mean, since I've been doing it my whole life, it's kind of like, just didn't even think anything different.
Yep, totally. Yeah. Okay, so you saw the ENT. What did they do for the deviated septum?
So kind of simultaneously this last year has been a bit of a whirlwind as far as what was happening with that, because one box needed to get checked off in order to do the other treatment, and so and so. So last summer I went to an orthodontist that specifically focused in treating headaches, TMJ, and things like that, rather than just a standard orthodontist. And
how did you find
that? When you don't sleep because of this, there ends up being hours and hours of staying up researching. So a long time, and I probably had looked through a lot of different options. Especially, I spent probably 6 months looking into the AGA route, and mostly didn't, just because there wasn't someone in my area that seemed like a reputable practitioner of it.
Mm-hmm. So you found an orthodontist by merely just Googling and searching like TMJ airway aware orthodontists?
Yep. Yeah, exactly. And he was willing to go forward, but kind of said, you're not going to get any progress with me until you also fix the airway issue. So this last summer I had a septoplasty. So they just opened both of my nostrils. And when they took the surgical packing out from that, it was like the first time in my entire life I've taken a full breath through my nose. It was pretty weird.
Wow. That's amazing. How did that feel?
It almost felt like I was standing in front of an air conditioning unit with just a bunch of cold air blasting through my face.
Yeah. Did that take time to get used to? I've heard, because the sensations can be almost too much. Like it's overwhelming at the start.
I would agree. It for sure was. For probably even a couple weeks, it just kind of felt like, like all up in the nostrils for sure. So
did you get ever like a brain freeze from the air just flying through so fast?
Probably like the first couple of breaths I took, that's almost how it felt.
Okay.
Yeah. And then simultaneously I've been going to the orthodontist for they had fitted me with a new top splint, and it was just flat, deprogram my jaw muscles so that they would then have an easier time moving them back where they needed to be. And while this was going on, because of my clenching and issues with that, I had a couple of areas that needed a gum graft. So then I got a gum graft this fall before the orthodontist could proceed with their treatment.
Really? Okay.
Yeah. And then it was kind of either that or after, but they didn't really want to do it in the middle of.
Yeah.
And then in early November, I got braces to help just kind of move my jaw back where it needs to go. And probably gone from having 2 or 3 debilitating headaches a week to maybe 2 or 3 a month. So huge improvement.
Did you notice an improvement when you were in the splint as well from your symptoms?
Yeah, probably almost immediately.
Really? Okay.
Yeah, just having, I mean, it felt sore from being forced back to where it didn't want to go. But as far as the tension in my muscles around the area, less headaches, and then just a easier time breathing the way I naturally need to be.
So the combination between the surgery and the splint, the upper flat splint, those kind of went together at the same time. They
Correct.
occurred.
Yep.
Okay. And then when you got the top splint, did you notice a decrease in clenching or grinding?
I think I did. Yeah.
Okay.
Yeah.
Tell me a little bit more about the splint. Did you wear it 24/7? Did you eat with it? Did you take it out to eat? Could you speak with it? How long did it take you to get adapted to wearing it?
When I first got it, I felt like there's absolutely no way I can wear this, especially in public. It just felt like a huge, horrible intrusion, essentially. Speaking was, I felt like I was learning to speak again, essentially.
Yeah.
Um, but pretty quickly I got used to it, and I was supposed to wear it 24/7 except for eating.
Okay.
Um, and it got to the point where it was kind of second nature and almost felt weird to not have it in. And I could tell that it was kind of holding my jaw where it needed to be. So it felt good to wear it almost.
Did you ever wear it when you ate? Ever?
Yeah, I tried to. I was kind of a little bit OCD about making sure it stayed clean. So I was pretty choosy about what I was eating while I was wearing it, but I had no problem eating softer stuff, or if I just had a smoothie or something like that, I would for sure leave it in.
Was it weird to bite down with that and to kind of masticate that food?
It definitely was. Yeah.
Yeah.
Yeah. But I'm in the same boat now because I have bite turbos in my mouth, and not being able to fully touch my teeth together was initially a very weird feeling.
Yeah. How quickly would you say you adapted to it? Was it a couple days, couple weeks, at least with your bite now?
Just a couple days.
Okay.
Yeah, it happened quick.
Okay. So mostly 24/7, minus wearing the splint for the majority of chewing or eating. And then how long did you wear the splint? You said almost immediately your symptoms were relieved.
Yep.
And how long did you leave the splint before? So that was like phase 1 for you.
Exactly.
1B, because you had a different kind of splint or night appliance
Yep.
Prior to that. Okay, and then you went into phase 2 with braces in November.
Yep.
Correct. Tell us about that experience. How did you know, or how long were you in the splint for again?
I was in the splint it was prescribed to be 3 months, but then because of my gum graft, it ended up taking probably more like 4.5. And I was going into the orthodontist on a weekly basis for more or less physical therapy. So they would kind of stretch out my jaw joint and give me some home exercises to do. And the exercises that they gave me were probably some of the biggest help that I got throughout the whole thing. Just in terms of keeping my shoulder and neck muscles stretched out and how far that goes to preventing my migraines.
Know more about that. So an orthodontist had you go in weekly, not just to check the bite on the splint to make sure everything was comfortable with that, but gave you exercises and physical therapy like structure on a weekly basis to go home. Did that include any kind of myofunctional therapy, like tongue exercises or lip stretches or anything specific to the mouth?
Definitely, there was some of that, and then like putting toothpicks in my mouth and kind of tracking how my bite was lining up, and practicing making sure that I was kind of trying to keep it as even as possible. So as we were progressing and stretching, the muscles were lining up the way they wanted them to be, I guess.
Yeah. What kind of, and then they also gave you neck and back, shoulder-ish stretches?
Yeah, so at first it was a little bit weird going in because I was surprised that they were doing all those types of things, but they would so it was cold laser that they would just kind of rub on those muscles. Some sort of like electronic kind of like a TENS unit type of thing, I think.
Yep.
And then the doctor would come over and spray what basically felt like cold compressed air. You know, it would make the muscle really cold, and then they would kind of just stretch my neck around like really thoroughly. And when I first started going in, getting my head even to just go this far over felt like very difficult. And, you know, I'm a lot more mobile at that point now, and directly corresponding with that progress was a lot less migraines.
Wow. So was it primarily the dentist that was stretching you and doing the laser and doing all of that? Or was there a dental assistant that primarily ran that program for you?
One of his dental assistants or hygienists would be doing the majority of the appointment as far as the cold laser and the TENS unit. And then he would come over and actually do the stretching.
Wow. That's amazing.
Yeah.
It's like an all-in-one
It,
kind of super cool. Okay. So then how did he determine, okay, you're done with this phase, we're ready to move you to the next? What was that kind of marker? Do you have any idea?
They did another bite analysis and another 3D X-ray to kind of see where things were at as far as alignment, and I think probably just kind of him making sure that my mobility and the tension in my muscles was a lot less than it initially was probably the marker he was looking for.
Okay. That's
Yeah.
awesome. So 2 to 3 months was initially the plan, and then it ended up being 4.5 of the gum graft.
Yep.
And weekly appointments. I mean, that's a lot on your own personal schedule to be able to, depending on how close the doctor is to you. I mean, if you have a doctor that's an hour out, to go there on a weekly basis, that's a lot. It's not just.
Yeah, it got to feel that way by the end of it. It was like, all right, I'm just glad to be over with this, just because it was such a commitment to my weekly routine.
Yeah, totally. But then you are also seeing the benefit of it because you were feeling better throughout your week. Were there some
Absolutely.
days where you were like, I'm excited to go because I really need this? It's like getting a massage, it's like,
Oh,
finally.
for sure. Yeah. Well, there was one week where the office was closed because of some office training, and I literally was disappointed and felt kind of like, oh no, I'm stiff and I need it. So
Yeah. Did you take home or learn anything to do you said there were at-home exercises that you learned to do?
yeah, I mean, I was supposed to be spending, it probably took me about an hour to work through it every single night just to get through all the stretches and
Wow.
stay on top of it.
Okay. And have you continued that practice since?
Yeah, for sure.
And so you still to this day almost do that every day or a couple times a week?
Yeah, probably even a couple times a day. And then if I can feel like a migraine's coming on, it really helps me to stretch out those muscles back here, and kind of it won't make a migraine go away, but if one's coming on, it can kind of help suppress it.
Wow, that's incredible. Okay, so beyond the cold laser TENS and the cold spray stretching, muscle stretching, did you work with a myofunctional therapist to address the proper way to breathe now that you can breathe, now that your airway is open? Did you look into that?
I had not. The ENT doctor had kind of initially brought that up and said, why don't you leave it up to the orthodontist? And the orthodontist didn't feel it was necessary. To be honest, at that point, I kind of felt like between all the different doctors that I've been seeing, it was like, that's fine. I'm okay with that.
It's a lot to do.
Yeah.
I would say, just because I'm partial and I think I know the total benefits of properly breathing, now that you can breathe through your nose, I know that you're probably more aware to like close your mouth and breathe through your nose, which is super crucial. I mean, I'm sure that you've taken that away at the very least. But if I were you, I'd look into a Buteyko breathing specialist, and that breathing coach, if you will, can really help to retrain you how to properly breathe beyond just nasal versus mouth breathing. Tongue posture, making sure your lips are together, which I'm sure you're big about. But those 3 big things, and then swallowing correctly. If you can get your tongue to be used correctly, after your orthodontic treatment, it will help to maintain everything in a stable position, so that you don't relapse, because if your tongue, it's still a muscle, if your tongue starts to do things incorrectly, which I'm sure you know, but especially breathing, if you're big into running, nasal breathing, making sure you're your belly breathing and not chest breathing, and the rate of breath, elongating your exhales and shortening your inhales. There's a whole thing that goes into it. And it's really fascinating. It's a lot. So, take a break. You've just been through a whole lot, but I would suggest at least looking into it in the future, if it's still something that you feel is necessary.
Yeah. Seems like a nice cherry on top of the treatment I've been doing to kind of drive it home.
Totally. Yeah. But I get it. It's a whole lot. It's like, you're asking me to do what? To go where? Yeah, especially after everything you've been through. You're just happy to be out of pain for sure.
Yeah, 100%.
Okay. Whew. So the splint, that was a lot. 2 or 3, or turns out to be 4.5 months for you. After the gum graft, how was that treatment?
Terrible. It was horrible.
Was it in the back, the front teeth? What exactly
my 2 canines, and then it was lateral incisor on the bottom left.
Okay.
So 3 teeth total.
Did you see a periodontist for that?
Yep.
And so it was just kind of a consult, going for the surgery, maybe a post-op, 3 or 4 visits. And
exactly.
How long was the recovery for it?
I was probably really not doing well as far as pain and what I was able to eat for about 2 weeks, and then kind of residual discomfort for maybe a month total.
Okay.
If you looked at it now, you could definitely still see that it's clearly
grafted
on there rather than the way it should be, but it's definitely healing well.
Did they take it from the roof of your mouth, or did they
did.
That's rough.
Yeah, I know. It was either that or bovine tissue. It was like, I don't want dead cow tissue in my mouth. So
I don't know. I've heard that the roof of mouth recovery is rough. I almost would be like, give me the cow.
Yeah. Honestly, the roof of my mouth healed within probably 3 or 4 days.
Really? Oh, wow. Yeah. That's good to know. Okay.
Yeah, it wasn't so bad. It was definitely more what I kept having the feeling of is that the graft was like rolling up, and it wasn't, but that's just kind of
the sensation.
Yeah.
So. Jeez. Okay. Moving on. Phase 2. November of 2020.
2021.
2021. Yeah, we're in 2022. Okay. November 2022 or 2021. You got your braces. You moved out of the splint into some sort of orthodontic treatment. Tell me about it.
It's the Pitts 21 bracket. So it's just no rubber bands. The brackets are pretty small. Going into it, I was really nervous, mostly from a superficial self-conscious standpoint, rather than being nervous about the, braces themselves, I guess. But pretty quickly got over that. Speaking was a lot easier with that than when I first got my top splint. It's been generally really easy, other than, as soon as I'm done eating, I have to go and manage the toothbrush situation. But other than that, it's really not been bad at all.
Okay. So Pitts 21, this is a system that your orthodontist primarily works with, or works with only with TMJ patients, or?
My impression is that it's only for, it seems like when I'm in there, the children patients are still getting to pick their rubber band colors and everything. So it seems like he more uses this system on adults. And I'd kind of initially asked about clear brackets, and he said that because of his treatment plan, they probably would be breaking more often than would be convenient. So they encouraged me to do the metal, and it was like reluctantly agreed.
Mm-hmm. I have heard that metal is faster than the ceramic ones. Whether that's true or not, I don't know. I think it's always going to be case-based, but some people have alluded, oh, well, you should have just gone with the metal, because I'm like, here I am still in braces and I have ceramic. So people are like, oh, you should have gone to the metal, but it is what it is at this point. So the Pitts, I wonder if Pitts 21 can even do a clear, like a ceramic. with its mechanism? Because it's
I
more of a
think that they
latch,
do.
right?
Yeah, it's like a door that slides out. I think that they do, but he said they don't offer them. So
Okay. Yeah.
yeah,
Yeah. There's some, I just know generally speaking, they're more challenging to work with. So it takes a lot
yeah,
more effort and people don't want to mess with it. So,
yeah.
did he give you any other options after the splint? Was he just like, this is the way it goes? For me, I do a splint right into pits, or did he say you have a couple options?
I mean, it was kind of there's sort of the just splint therapy with physical therapy as an option, and then adding the orthodontic treatment on. Um, the benefit of adding the orthodontic treatment onto it was basically that I would need to continue wearing the splint if I didn't go into braces, just to kind of hold my jaw where they wanted it, rather than it um, being fully healed or told to go in the right direction more permanently, I guess. Um,
So you're saying you would have worn the splint for the rest of your life?
yeah, I think more or less. I probably, if I remember correctly, it seemed like he was saying probably just as a nighttime splint moving forward.
Okay.
But it was enough of a burden to constantly mess with that I figured, rather than deal with a lifetime of that, I'd rather just spend the next 18 months fixing it and hopefully be done with it.
Did he ever give you any like restorative options, like say, hey, you could have crowns or any, um, you know, I guess restorations is the only term I can think of, but like basically putting crowns on your teeth as a permanent splint so that it's not like something that goes in and out of your mouth? Did he
No,
ever
that
mention
was
that?
no.
Okay. So his options were pretty much start to minimize the use of the splint and only wear it at nighttime, kind of like what your first doctor had you do almost, right?
Hmm.
And or move forward and correct the bite by manually manipulating the teeth.
Exactly. Yeah.
Okay. So how has he, wait, let me go back. When you were in the splint, did you find that your lower jaw was able to come lower, like come low and forward? Like you were saying the
Um,
first splint was pushing you backward.
yeah, that's kind of what origins of my problem is that from mouth breathing, my jaw was going down and forward too much. And in the 3D X-ray, it measured that my jaw was just kind of constantly sitting about 3 millimeters out of the socket forward.
Mm,
So it being pushed back by that first splint was, I think, the right idea. It just wasn't executed appropriately, considering my breathing, is my
yeah.
impression of it.
Okay.
Um, this whole thing is also fairly, it's like, unfortunately, what we deal with being TMD patients is that it's not focused on by dentists as much as it should, or doctors as much as it should. And no one in the health profession really wants to take responsibility for it, or in the insurance industry. So kind of having to piece all these things together myself has probably been the hardest part of it.
Mhm.
I think that um, my idea of what's going on has just been listening to all these doctors, and putting that puzzle together myself, rather than having one doctor say, this is what's going on and this is why, here's what we do about it. Um, so yeah, I guess to your question, that's kind of been my overwhelming complaint with the whole process.
I 100% agree. I think, well, dentistry in the last 10 years has excelled tremendously. I feel like due to the economy, dentists, there's been more money in the area, like to do more research, to spend more time doing that. So like even with lasers or, x-rays and all of that
Mhm.
technology, 10, 15 years now has really excelled, which is wonderful. But I feel like our resources really need to go to the unknown, which is TMJ. I feel like it's this big question mark. Nobody knows how to handle it. Everybody in dental school, they learn how to do bite adjustments, but it's so zoomed in on the tooth and the two teeth and how they come, maybe the four teeth, maybe the left side, but to take a big step back and look at the whole face and to look at the whole jaw system and complex, I mean, it truly does affect the whole body. And
Yeah.
it's unfortunate that that's been completely missed. They don't teach that in dental. I've never been to dental school, to be fair, so I don't know, but from what I've heard, just talking with dentists, they don't teach that completeness. They might allude to it and say, oh, also, by the way, but the TMJ is such an unknown joint that is different for everybody. And that's part of the reason why I think it's so challenging. You have a molar and a top molar, and we know how they're supposed to come together, right? And so we can kind of try to replicate that in everybody. But when you have a TMJ joint that might be too far forward, too far back, like where is its ideal place?
Right.
And it's just so complex. Like, the younger children coming in, they grow and they develop, and they might end up having a problem with it. Later on in life, how do you correct that problem? There's just so many different ways to do it. It's compounding.
Absolutely.
So, and not one person has all the answers. So you're totally right by saying piecing it together is a necessary component. And we really need our community, the orthodontists, the periodontists, the general doctors, all to come together. And I think we're getting there. I think airway awareness has increased significantly in the last 5 years. But the link to TMJ, I think, is still missing a little bit. And it's hard. It is hard. So I applaud you for being able to kind of piece the pieces together. But that's part of the reason why I want to start doing this and interviewing people, because sharing your story is just going to allow somebody else to kind of be like, oh, I hadn't considered that. Let me look into that. And you are your own best advocate. Every TMJ patient is. And it's just rough. It's really rough.
Yeah. I've realized how many people out there are affected by it. And if I had to dig through so much just to get where I'm at, that means everyone else would have to as well. And that's rough.
Yeah. All right. So you're in braces. How far along are you into the PITS 21 system?
About three and a half months, I think.
Okay. And does he know how long you'll be in it for?
They estimated about 18 months.
18 months. Sorry, my cat is about to join me here.
Look at that tail.
I know. She's fluffy. Okay, so PITS 21. I don't know a whole lot about the system. I know the bracket concept, but as far as it moves the teeth, like I'm very familiar with the way that controlled arch moves the teeth. It's certainly more of a, to my understanding, a protractive technology or technique, which is incredibly challenging to accomplish because you're going against, all the forces, right?
Right.
So how does the PITS braces align your teeth? Do you know? Have you looked into that and how it's different besides the bracket system, the actual mechanism? But how is that different?
My limited knowledge on this is that the really key difference between those brackets or this system and traditional brackets is more the way that the square wire interacts with the bracket itself. Beyond that, I would assume that it aligns, would it be the occlusion where the bites coming together, the same, because I just have hooks with rubber bands that I'm supposed to wear in a certain pattern. And
okay.
Yeah.
Do you know if they're trying to move the molars up and into occlusion? Were you more hitting on the front teeth versus the back teeth? Do you know how much you know about all that?
So when I was biting as I went into the orthodontist, because of my mouth breathing, I was essentially my front teeth are coming together. And it was causing a lot of problems as I was chewing, those would hit together. And it's like, that's not how that should be happening. And so they're trying to move my lower jaw back. And then also like my canines are a little bit more forward than they should be. So there's just a couple of adjustments that need to happen in order for my bite to fit together properly.
Okay, so they're trying to move the lower, I wonder if they're trying to move the lower jaw back. Well, I guess, yeah. I mean, I don't know what your CBCT looks like and all of that. And they're trying to move your canines back. I always am just concerned about the roof of the mouth and its size. So if they're trying to move everything back, that's, I get worried about that term only because that's where the airway is, right at the back of your throat. So if we move things back, we're moving things into the airway. So I get concerned about that. I don't know that
Yeah.
you're this specific case, but it just makes me want to look into it even more because I'm uneducated and I don't know.
I'm sorry, go ahead.
No, please.
When I initially went in for my 3D x-ray, they were actually able to kind of paint in my airway on the 3D x-ray and measure the volume of it.
Yeah.
And then did that again after my septoplasty. And I was on the very small end of what the airway should look like before that surgery. And he said it was as big as it needs to be or should be afterwards. So my airway space is great right now. And then I guess the only other comment I would have on that I think is beyond the bracket system is that the arch itself is constantly trying to pull my mouth wider at the same time.
Okay.
So I think they may be going back a little bit, but also out.
Okay. All right. Cool. Yeah. That's always because I'm like, let's make that palate big because your tongue isn't going to get any smaller. So we need to be able to get that tongue up on the roof of your mouth. And if we're making it smaller and smaller, that's the opposite of what we would want to do. So that's good. That's good to know.
Yeah, well, that's exactly why I think the AGA had initially stood out to me, because I felt like my issues were obviously coming from a lack of airway. So increasing that was my first objective.
Yeah, totally. I'm yeah, aligned with that thinking too. All right. So you're 3.5 months in, right?
Yep.
5 months in, and you have 18 months potentially total. And you've been out of pain, or your migraines are down to 1 to 2 to 3 a month.
Yeah. Yep.
What do you take for when you get migraines?
I usually have either Aleve or Excedrin. If I can drink a bunch of water before the nausea starts setting in, that can help. But yeah, my migraine's very much subtle as it's behind my eyes and just a lot of nausea. So getting on top of it before it sets in is important.
Do you notice if there's one thing that kind of sets you off, like if you're staring at a computer for longer than 6 hours or something like that? Is there anything that seems to be a trigger for migraines, or not specifically?
Like lack of sleep, strong odors, stress. If stress is kind of causing me to be clenching more, and then those muscles get tighter than normal, that'll do it. Sometimes they just come for no reason whatsoever.
Go back to strong odors.
Yeah.
Strong odors?
So like, if I was in a place where a lot of people are smoking cigarettes or like industrial chemicals, things like that.
Wow. Okay. But you're able to kind of manage it with a simple over-the-counter painkiller, basically.
Typically, if it gets bad enough, I've definitely had to go to the ER, and they do the migraine cocktail through the IV. So, maybe even a couple times a year, sometimes I have to do that.
Yikes. Wow. Okay. You have been through it.
I've been a migraine sufferer my whole life, so it's nothing new.
Yeah. Wow. Oh, I can relate to that earlier in my life, but thank goodness. Yeah, I have not suffered from migraines like that in a long time. Time. And I never have been to the ER for that. I just tried to go to sleep, which as a kid I think is a little bit easier, but
yeah.
Phew. All right. So 18 months till the end of your treatment, and I'm sure you are ecstatic
yeah.
about that. Anything else you think is important to add?
I think what my biggest takeaway is that from my own process at least, is that if I hadn't addressed each of the issues independently, I probably would just still be where I was at. If I had just done the septoplasty, my jaw tension would still be causing me the migraines. If I hadn't done that but addressed it just orthodontically, I'd still be mouth breathing and kind of fighting an uphill battle in that regard. So
Mm-hmm.
as time consuming, mentally taxing, and expensive as it was to go through all of those processes, it was by far worth it, because I can see now that I'm very much headed in the right direction.
Yeah. There is one video one of my mentors had shown me on YouTube, and I can send you the link too, and I'll post it below in the description box. But I think that video is more specific for TMJ. I had already been connecting the dots, and my education had been connecting the dots for me. But, you know, as you think about it, it's more and more. And this one video, it's about a 10-minute video long, I believe. And it is like a whiteboard. And this guy draws things and connects dots. And it's just like, wow, it all makes sense. So I'll send you that. It's really fascinating.
Okay.
But
I'd love to see it.
you probably know everything already. But yeah, I will definitely send that along. It was very eye-opening for me.
Yeah, awesome.
I love to send it to patients too, because I'm like, you have to understand the whole complexity of it. It's not just, you can't just take a pill for it and it be done. We're truly curing, or attempting to, thinking we're curing and fixing the root of the problem, not the fruit of the problem, right?
Absolutely. Yeah.
Yeah, that's huge. So, okay, I do have a couple questions. Do you mind? I get often, I know that people will be asking these questions, which is why I'm asking them. And feel free to say you decline to respond or answer.
Okay.
I want to ask two things. Do you mind sharing your doctor's name?
Not at all.
And do you mind sharing the price factor, how much you paid, what the finances were for the entirety of your treatment?
Yeah. I think that, you know, when I was just going to my dentist, the splint that I got, the lower splint that I got from them was about $500. And that at the time seemed like, you know, outrageously expensive, but ultimately ended up being a drop in the bucket. The septoplasty was probably like $5,500, something like that.
Was that with insurance?
Yes. Yeah. The gum graft with dental insurance, I think it was about $3,500, and I paid maybe $1,800 of that. And then if I had just done the TMJ therapy at the orthodontist, I think it was $4,800, $4,500 maybe. And then to do the whole orthodontic treatment, including the TMJ therapy, was $6,500.
$6,500. That was TMJ, the PT splint, and braces altogether.
Correct. Yep.
Okay, so just braces alone was whatever the difference is between 6,500 or 48 or 45.
My impression, oh, my dog's going crazy.
You're okay.
My impression was that if I had just done the splint, because that was, you know, the majority of that cost was just the splint. My impression was that they were giving me a cheaper deal on the orthodontic side of things for having gone through that. And if I had just done braces, I think it probably would have been, I think it was closer to like $5,000 for just that.
Did they say just braces was an option to help treat the TMJ?
I had asked that because I specifically thought, well, could I just save some money and skip right to the orthodontic treatment? And he said that he wouldn't be able to guarantee the results as closely, just because my muscles would still be so tight and uncooperative. And he really just wanted to deprogram those muscles so that they were kind of a blank slate for him to put back where it needed to go.
Yeah. Awesome. I love this guy. Where is he located? Who is he?
Fort Collins, Colorado. He was actually, I didn't realize this when I scheduled an appointment with him, but he's the older brother that I went, older brother of someone that I went to elementary, junior high, and high school with. So
get out.
Yep.
Wow, God is good. That's amazing.
Yeah, it's Dr. Jared Ward at Ward Orthodontics. So I'll send you the link to it.
Jared
Ward.
Ward.
Yep.
Please do send me that link. That would be phenomenal.
Yep.
And he's treating TMJ. He does standard ortho, splint therapy, and braces for TMJ and airway patients.
Yep. Correct.
Amazing. Yep. Gold star to him.
Yeah.
It's great.
100%. His ability to measure my airway and base my orthodontic treatment off of that, I think, was probably the biggest key factor in my entire treatment.
Yeah. And the PT, the weekly PT, and making sure that that was a primary contributing factor to your splint therapy. I mean, that's
Absolutely.
top notch.
Between discovering all of this through your videos specifically, and then going to him for this treatment, it's literally been life-changing, because I was getting to the point where I was losing weight kind of uncontrollably because I just wasn't even able to eat or sleep, and getting myself back on track and being able to show up to work and do my best and all this type of stuff is huge. So
wow.
I appreciate your videos.
No problem. I appreciate you sharing your story. I'm just, that's why I'm here. People need help. This is crippling to
Absolutely
many.
is. Yeah.
Mm-hmm. Okay. That was his name. Oh, I had another question. I should have written it down. Oh, how far did you drive to his practice on a weekly basis?
So right now I'm working in Oklahoma, so I'm not close to his practice at all. So I just go home, once every 8. I'll be going home once every 8 weeks for his appointments. But when I was going through the physical therapy part of things, my job was about 20 minutes away. So I'd go on my lunch break and just take an extra hour for lunch each day.
Okay, so yeah, so you were, when it was weekly, only driving about 20 minutes.
Yep.
And now you're flying. Are you flying?
Yeah.
Gosh, yeah. Every 8 weeks.
Yeah. Very, very worth it. It's a great work opportunity here in Oklahoma, and the treatment I'm getting from him is life-saving, so it's very worth it.
That's awesome. Naturally, because I am a dental hygienist, I have to ask, how is your home care? How easy is it to take care of your braces? Are you using a water pick, an electric toothbrush? Are you flossing regularly? What's your deal?
I've always been a little bit, pretty routine about that type of thing, even before my splints. And then, like I said, with my splints, I was pretty obsessive about keeping them clean. So I'm doing that same routine with this. And essentially, as soon as I'm done eating, I go brush, make sure I get my rubber bands back in. I have a Sonicare toothbrush, a water pick. I have a little metal dental pick to kind of get in the back.
Careful with that.
I know you definitely have to be careful with that. And then I have those flosser things that specifically for brackets, so I can keep flossing. And it's generally not been, other than needing to maintain the routine, it's not been that much harder at all.
Okay, cool. Yeah. Doc name, finances, home care. I think I've covered everything. I know a lot of people always come up with questions that I never think of to ask, but do you want people reaching out to you, or would you prefer not to have?
No, that'd be fine. You could put my email address in there if you want. Okay,
why don't you tell everyone, your Facebook or your Instagram, whatever best way to contact you is.
Okay. I don't have a Facebook anymore, but my Instagram is Sean Climbs. It's SeanClimbs.
Okay.
And then should I do my email?
Sure, if that's how you prefer people contact you.
Yeah, that's fine. It's Sean, Sean, Bradley, Bradley 970 @gmail.com.
And I'll link all that information below. But thank you for your willingness to share your story, and for even allowing people to contact you, and sharing your doctor's names and your whole finances. I mean, I think this will really be able to give some people an idea of like, what's normal? Is this too much? Is this expensive? Or where do I have to move? Where do I have to go? I mean, people are looking, they're willing to uproot their life to get some good treatment. So thank you so much. And keep me posted with when you come to the end of treatment. I'm curious to know, maybe we can kind of do a reunion and see how you land at the very end of it. And maybe your migraines will be 100% gone, ideally. Hopefully they're not all back, but we will, I would love to do like a follow-up and see how it all turns out for you.
Okay, that sounds good. We'll be in touch.
Thank you so much, Sean. I really appreciate it.
Thank you. It's great talking to you.
Yeah, you too. Have a great day.
You too. Bye-bye.
Bye.